And he said something to me that I'll never forget. He said, "Dr. Anderson, that's a great presentation. You have a lot of good data. It looks like you're on the right pathway. This looks like a new solution for restless legs. However, it's going to take 17 years for this to be adopted by the masses." And I can see that now because I've been doing it for about 10 years or more, and it takes a long time. There's nothing to monetize me with. In other words, things that move forward fast in medicine have outside collaboration with a drug company or maybe a medical device company that helps promote. They got the deep pockets, they've got the marketing capabilities. Hey everybody, Dr. Anderson here, and I want to talk to you about an idea. And this idea has to do with your restless legs. And the idea is something that I've been doing for about the past 10 years. It's the idea simply that your restless legs is caused from, in many cases, tight nerve tunnels in the lower extremity. That idea is what keeps driving me forward. It's what keeps driving you forward. For many of you that have come in and seen the benefits of having surgical decompression for your restless legs, you are becoming a bit of an army because you are also following this idea. You like the idea. You like the possibility that maybe you can even have an influence on other people to change their minds about the narrative that's out there. And I think that's what drives me more than anything, is this basic idea that we in medicine, doctors have been looking at restless legs from the wrong point of view. I've got to confess, I was up doing my weekend hike in the mountains, and I get very stimulated sometimes just thinking about what I do in my work, and decided I better get cleaned up, come in on the weekend and do a couple videos. So that's why I'm here. And I might be kind of rambling along, but I want to try to bring together some ideas of what's been happening in American medicine in the past several years, because I truly have to stick with what I know, and what I know is that so many of you have had your lives massively changed, massively improved by coming here, and that's something I really think is amazing, that I've earned your trust to come here, and now you're having other people come because you trust this idea that the restless legs that you're suffering with can be reversed, and that medicine's been looking at it from the wrong point of view. And I want to mention that even though I'm a small voice, I'm a private practicing doctor in Colorado, I have done research, and I like to frame it as I'm an independent researcher. I'm not a centralized doctor. There's a lot of centralized medicine going on in this country, and I think if we go back whenever 3 years ago or so when COVID first broke out, everybody was panicked. And looking back now, I think no matter what your belief is, I think many of you are questioning if it could have been handled better. Many people possibly could have been killed being placed on ventilators. Medications that were banned at the beginning of COVID are now almost recommended to be taken instead of or in alignment with the vaccine. And in fact, lots of evidence that the vaccine had some very detrimental effects, and I've actually seen it in my own practice with nerve conditions. And the #1 video that we have on YouTube isn't related to restless legs, which is my main big passion, but rather a lady that had severe nerve damage from COVID vaccine. It was very consistent with her getting her first, second vaccine, and even then got a booster, and at each step her nerve condition got worse. And it was very interesting to follow her, because her video on YouTube, I think, was sort of a barometric way or a forecast of what's going on in the kind of the organic world on YouTube with the public sector. Because when we first put that video out, I don't think there were over 100 videos that were watched for maybe 5 or 6 months, which is unusual. Usually you put a video out like we put this video out, and it'll go up pretty quickly within the first 2 or 3 days, and it kind of plateaus. Her case was just the opposite. for probably 4, maybe even 6 months. I think less than 100 viewers. Now, and starting in September, I think the video was done in March. I can't remember which year, but March. We put the video out, and I think in October that year, it just started to go off like a rocket ship. I think it's up to about 30,000 views now, which for us is quite a few. So, and that tells me that a lot, her name's Kimberly, by the way. So, and that tells you that a lot of the public out there is starting to question and see kind of the bad side effects from the vaccine. So, and that's why I want you to understand that that was driven by big pharma. It was really driven by, centralized medicine. It wasn't that way in a lot of other countries, but it was definitely like that here in America. And I think a lot of you are starting to question that, and I think that's a good thing. And I feel like what I'm doing with Restless Legs is somewhat similar, because I'm up against big pharma. I'm up against doctors, and many doctors are very well-meaning people. They're really trying to help patients, but they're lost, and all they do is give you medication. They give you ropinirole, Mirapex, maybe gabapentin, Lyrica. They're medications that you often will take. We have other videos to talk about that. But it's interesting because our results from our surgery are probably way higher than their results from these medications. In fact, we have intraoperative nerve testing to show that we can improve your nerve function in the nerve tunnels in the lower extremity. That's objective data. Where you contrast that with the idea that you have dopamine transmission problems in the brain. A lot of times you can find things out with a good brain scan, and the studies on brain scans of people with restless legs versus those that don't have restless legs are very questionable, that really may not even show much difference between those two populations. So over here, I'm saying, hey, we do have evidence, objective evidence, and hopefully it will soon be published, and I'll show you some information on that here shortly. But on the conventional medicine side, centralized medicine, if you will, you're not hearing that. And I tell this to patients when they come in. A doctor like me is not monetized. And in fact, one thing that happened to me several years ago, I gave a talk, I think it was about 4 years ago, to a group called the Society of Opportunitorial Physicians, and gave a talk, and the main doctor at the meeting, after I was done talking, people were really interested, a lot of doctors are there, and he said something to me that I'll never forget. He said, "Dr. Anderson, that's a great presentation. You have a lot of good data. It looks like you're on the right pathway. This looks like a new solution for restless legs. However, it's going to take 17 years for this to be adopted by the masses." And I can see that now, because I've been doing it for about 10 years or more, and it takes a long time. There's nothing to monetize me with. In other words, things that move forward fast in medicine have outside collaboration with a drug company or maybe a medical device company that helps promote. They got the deep pockets, they've got the marketing capability to promote it to the general public, and that's not always a bad thing. Somebody comes up with a better knee replacement idea, great, God bless them. That company should benefit, orthopedic surgeons do more of that surgery, and then the patients themselves will benefit. It's not that way in the world of nerve. In the world of nerve, in the lower extremity, it's really a lot about big pharma and the medicine that you're being taught to take, and doctors are being trained to give you as the main option, or else just kind of living with it in many cases. So that's what I'm trying to explain to you, is that I think more of you are beginning to question what you're hearing from big pharma, maybe centralized medicine, which is revolving around, maybe FDA, big pharma, and all that. Not that that's all bad, but in terms of the nerve conditions that we deal with, it's something that I have a challenge with in many cases. So with that being said, I want to talk to you for just a minute about two different things that you might want to look into. I have a book here that you may have heard about. It's called A Perfect Night's Sleep. You can purchase it on Amazon. And in this is some data that we hopefully are going to get published in the near future. It's taking us a while to get our second paper published. We already have one paper published. But there's a chapter in here, chapter 9, it's called The Game Changer. And if you look in this is called the Game Changer Intraoperative Nerve Testing. And if we kind of look through here, this is an EMG scan that we do. What that means is we go in, we stimulated the nerve tunnel before it was opened. Then once the tunnel was open, to get rid of the pressure on the nerve, we then tested it again. Basically, this measures how much of an electrical signal goes into the muscle. We had little needle electrodes in the muscles to pick up the impulse. And then if you go a couple pages later, it will show you the changes. Now this would be how it would read out. This would be a before number and an after number. You can see the time here when the measurements were taken, and then you can see how the measurements have changed. These are two different muscle groups. Before the tunnel was open, it was at 4,945, and then afterwards at 16,000 millivolts, and then before 594, and then after 2,091. So that big change, and here's the percentage of change, 336 and 352 percentage change. So that is very objective evidence. An EMG machine doesn't lie to you in the operating room. So it's not just the patient saying they're better, but it is also the machine saying that they are better. Again, that hasn't been published yet. A lot of that data has been collected and it is ready to get published. This would be another, this is a published paper. This was published in Frontiers in Neurology. You can look this up on our website. We have a section at Anderson Podiatry Center where you can find this. And I actually have an award that was given to me by my peers for the research that we've done on nerves in the lower extremity. But this is about nerve decompression for restless legs. And if you go to, I think it's about the 4th or 5th page, I'm not going to go over all of this, but this is just a before and after representation of all these symptoms, both neuropathy and restless leg symptoms on these subjects. The dark bars are the numbers that they had before the surgery was performed. The higher the number, this would be on a scale of 1 to 10, for instance, maybe creepy crawly sensations, maybe cramping, maybe jerking. That number might be, let's say, 7, 8, or 9 before surgery on a scale of 1 to 10, and then after surgery, the numbers that you can see, and kind of the gray bars goes way down. All the way across the bar graph, all those bars after surgery are significantly lower than those are before. And then this, of course, this is subjective. This is what the patients reported to us. So, and I must say I was motivated too, because I just called a patient this morning right after my hike talking about how fantastic her left leg was. She came here from Georgia. And again, that was one thing. I just have to get in here and share some more information with you. So really consider doing that. Look at this published paper on our YouTube channel and really consider purchasing A Perfect Night's Sleep. It was actually endorsed by somebody that mentored me years ago, Dr. Lee Dellin. He's a neurosurgeon, plastic surgeon at Johns Hopkins, and then also endorsed by Dr. Marie Samanow, who was the first plastic surgeon to do a face transplant. Very interesting lady, but really they both looked at this book and they've given their stamp of approval to it because they both think it's a pretty scholarly book, giving you a lot of good hard evidence. So it takes courage to do this, to come here. I understand that. But because you're going against the grain, all that noise you're hearing out there with Big Pharma does not necessarily support what I do because they're in the business of selling drugs. In fact, last night, I don't do this hardly ever, but I was just at home looking on YouTube to see what's out there about restless legs, and it really angered me. I saw some news, I think it's down in Houston, different doctors were being featured on the news talking about restless legs, and very frustrating to hear how they're being interviewed about taking dopamine and agonists and taking medications for this and how it helps, but it's hard to get off of them, etc. So please understand, I'm changing the trend. I'm trying to create a tribe, and a lot of you listening, you've been very faithful about sharing this with other people. I know a lot of you are on Facebook support groups, and we really appreciate how much that you supported what we do here. And also for those of you on YouTube, please consider subscribing. I think that's about it. I just wanted to explain a little bit more about how you, the masses out there, I think you're starting to look at things more critically in medicine. And I will say one more thing before I sign off. Medicine has really gone down a pathway. I've been in practice, around 40 years now. It's been a while. So it's really gotten more and more into figuring out how to manage problems. I can't emphasize that enough. Management of problems has become the theme. And again, I think it's because of drugs and big pharma. Where over here, doctors like myself, or maybe we're in a specialty area, we're looking at, no, what is exactly the problem? How can we remedy this? How can we fix the problem? There's a place for medications, I get it, but how can we dive deeper and really find out the source? And that's what I'm trying to explain to you. We have found the source of restless legs for most of you. Please consider this as an option, especially if it's serious. Don't ruin your life by continuing to wait. It's really important that you have an understanding of this, and make sure you read the book, maybe look at the paper before you come here. I want you to be educated before you make the choice of coming here to let us help you reverse your restless legs. So thank you for watching, and please consider subscribing to our YouTube channel, and also we'd love to have some comments. We appreciate those, and thank you for watching.